Aloha, everybody. How you doing, Mel?
You are. I'm doing
I'm
good.
I'm up and running, man. All
I,
cylinders firing away.
I can
Today
tell.
is a special day.
I can tell.
Everybody, thank you for buying the shrimp.
Let me just put that on here. Oh,
Yes.
Patsy wants to thank all of you that purchased the tickets for the shrimp. Thank you very much. We did our deliveries today. Appreciate you guys. You guys always come to the answer the call. We love you guys. Thank you so much. Pop Warner, thanks you. Without a season, they don't have fundraising. They don't have anything. No more food booth, no more zero. So the league still has expenses. They got to pay the insurance, whether you play or not.
And Kawhi shrimp.
And then, of course, Kauai Shrimp. Kauai Shrimp for providing the shrimp. And of course, Auntie Stephanie Iona, who always makes it
That's the
happen.
hookup.
She's the one, man. She's
You're
the
not.
golly. She hooks everybody up, whether it's shrimp or it's pumpkins or it's watermelons or it's food for the needy. That
Or,
woman does not
or,
get the
or
recognition that she deserves, bro. She simply doesn't. And so from all of us here on Kauai, Auntie Steph, I don't see her or listen. I cannot hear that she's there, but pass on the message that we appreciate all that she does. While it doesn't get
so,
the recognition it deserves, she got to know that we appreciate her to the moon and back.
okay. I will pass it on to her. I've said it before. I've used that term to the moon and back. Uh, but she sort of gets lost along the way. So we try not to send her to the moon and back, okay? Because she will take the scenic route. That will come back in like 2, 3 years. Okay?
Oh, Charlie doesn't get well.
Somebody is making a comment, said they like my shirt. I just wanted to, I think you had one of these too, Charlie.
Yes. Yes.
So that's the kind of mood I'm in today. I wear the shirts I wear. Like if I'm in a professional mood, then I'll probably wear a polo. I don't know what kind shirts you have, bro. I don't know what kind of expensive shirts, but sorry, throw on polo. If I'm kind of like a relaxed mode, then I might just wear one t-shirt, the Kawaii Strong, or one of our shirts. And when I'm in a feisty mood, then I wear something like this um,
Yeah.
because I could laugh, cough, pee, sneeze, and fart all at the same time. That's kind of how I feel today. The head is spinning. You know, I actually thought about this morning, Charlie. I actually thought about taking a break tonight. Just say, you know what? Let's take a break tonight, man. Let's relax, take a night off, and then of course
Twice to dinner.
the messages start coming, the news, the breaking news start coming, and then all of a sudden it's we got a red for anger. No, I'm not angry. I'm not angry at all. To be honest with you, I'm frustrated, but I'm not angry because and I'm not going to say I feel validated, but I got to tell you that everything we've been talking about, Charlie, for months now, um, is kind of, yeah, Cliff, I miss working with you too, bro. I miss working with you too. Everything that we've been talking about is basically coming true. I mean, and listen, it's not just me and Charlie. It's what many of us have been saying. Many of us, I know most of us on this show right now, most of us feel the same way about, we really didn't take the safe approach as the safest possible
Mhm.
approach. We were rushing. We were rushing. We didn't have all of our ducks in a row. We just couldn't wait. We couldn't wait. And now as we hear the news and when we see what's happening on Lanai, when we see what's happening on Oahu, and you look, the today 4 more deaths on Oahu. I mean, nobody talks about the deaths in Oahu. And I said this before, Charlie, probably several months ago. You remember after the Desert Storm and all of these conflicts we had in Iraq and Afghanistan and all of these places. Remember in the beginning, just like COVID, when someone died, the state stopped moving, right? Remember, everybody at home stopped and said, "Oh my goodness, oh my goodness." And the news would spend time on that story, and oh gosh, this person. And as time goes on, they just report it as if it's a number, just like the war. Well, today 14 service members got killed in Iraq in an ambush. Next story, it was only 14 guys, and it's like that's the feeling I get. Four more deaths. They reported actually 14 new deaths today. Of course, 10 came from mid-September to early October. So four new deaths, but on the record books today, it will count as 14. Now, what the hell kind of record keeping is that? I mean, if you did that for your business, you go broke, you go
Brother,
bankrupt. You can't do that kind
all
of
I can
stuff.
say, it reminds me of my days back in the police department when someone calls you up and it says, yes, respond to so and so street. It's the third house on the left, but that's not the house you're going to go. You're going to look at the house on the right and go two houses above that. Right there, look where the mailbox pointing, and that could be pointing at the house you want to go to. That's the kind of directions we get.
I agree. I agree. So, the big news today is Lanai. Uh, 16 cases, right? It started off with four. We talk about the exposure or the infection rate. Remember, we talk about the 2.8. Well, when you go from 4 to 16, that's a quadruple infectious rate. That's kind of bad. It's a cluster. It's the same cluster. So while the 12 additional may be community spread, where the heck did that first four come from? Is it a coincidence that this all happened after we opened the state? Is it a coincidence that last week their mayor opened up intra-county travel, Maui, Molokai, Lanai? People can travel freely without any quarantine, without any test.
Yep.
Think about this, right?
Yep.
So while I think everybody thought that might have been a brilliant idea, well, now you connect that or you put that with the fact that people are flying into Maui from the mainland that could possibly be infected. Those people from the mainland that go to Maui infect Maui people that can fly to Molokai and Lanai without taking a test, without quarantining. And people wondering, how did that happen? Charlie, is it a coincidence that this all happened after October 15th?
Well, let me look at it this way. Okay. The planning stages. The planning stages, folks. I'm in a real good mood tonight. Okay, gonna be right on time with everything we got to say. But let's talk about the planning stages for the beautiful island of Lanai. Okay. First of all, when they opened up that inter-island travel within the county itself with no quarantine, take a look at this. You have two hotels. Okay. You have one gas station. You have two general stores, pretty much. You have a small hospital. You want to call it a hospital, but it's pretty tiny. Okay. Now you've got an airlines that's going to shut down, so you only have one airlines left that only has two flights a day, and you have a barge that only comes in once a week. I think you should have done your planning around those demographics first before you did anything else, right? Because now you had the fact that you're having an infection going on, and it's been reported that some of them have symptoms. So if it gets worse, how do you fly them out if you only have two flights a day? You have to call somebody in. That's this kind of stuff. So now what happens, because we all know that when something like this happens, especially for Lanai, and they go into a shutdown, guess what happens? A population of 3,000, they all gonna make a mad rush for the store to buy whatever they gotta buy. And if the barge only comes in once a week, you can be rest assured that store is gonna be sold out in no time. You should have thought about those kind of stats should somebody get sick. That's why when you do these exercises, You don't get real live bodies and shoot them and say how you gonna remove them off the playing field if you get an active shooter case. But you run simulations. You run simulation. What if this happened? What if this happened? Do we have all these backup plans in effect? That's my biggest fear for a population of only 3,000. Okay? You have visitors coming. It's not a hidden secret. You have visitors coming to that island. Now, we're not saying it's them, but I'm saying you add to the mix. Okay? So like you said, Mel, how does it go from 4 and ramps up to 16, what, in a day? 2 days?
Well, Charlie, let me just interrupt you real quick because I just got one post. You probably see it in the feed, but we were talking to Lynn Decoit, Representative Decoit. They're actually doing a Facebook Live right now for the people of Lanai, for the community. But Pat just posted, he's apparently watching this and watching us. He says, 23 positives confirmed as of today. Just announced exponential growth tomorrow per Lanai health professional on Senator Kalani English's Zoom meeting right now. 23 positives. Remember we were talking earlier, Charlie? I said it was 4, went to 16. What did I say? Tomorrow gonna be 32. And that's being very conservative because that's only a double. It's not a quadruple. But if we're at 23 now, and that's just because as the tests are being done and the tests are coming back, guys, and this is exactly what we've been talking about. And again, when I say we, Charlie, it's not just you and me. It's
Well,
the 3,000, 4,000, 5,000 viewers that all share in that same concern.
I don't mean to interrupt, but I think it's important because I want to chime in what you're saying. You're hitting the topic right on the kini popo, okay? Because when you take an island like Lanai with a small population, folks, this is a cutaway of real time what's about to happen because it's a small population, small island. It's like if we took one section of Kauai or one section of the big island and that was to explode, what's happening in Lanai, that's what you're gonna see. So now we talk about, it should be easy to contact trace because why? Everybody knows everybody on Lanai. That makes it easy. Just imagine if it was on Maui, right? You got all these new bodies coming in. Just imagine what's on Oahu. You have all these new bodies coming in. Just imagine if it was on a big island. Not only new bodies, but a big territory. You got to go hunt down people. That is the reason why you said it, Mel. These kind of things, if it's not done properly, and I don't mean to laugh, I'm just saying, you called it, everyone who's been on this show, who's called what would happen if something like this definitely happened, you're spot on 100%. So I look at that as us fear mongering. I don't think so. It's happening in real time right now.
And all we've been hearing the last few days is how wonderful we're doing. I heard it again today, one of the governor's press conferences, or how wonderful we did, how we got double the amount of people that we expected, and we did a great job at the airport. And Honolulu, so excited because they're going to go to tier 2 tonight at 12:01 midnight, at 12:01 a.m. He said, we're going to go to tier 2 because the governor approved it. Again, minimizing what, to me, we just found out about Lanai. We're just finding out now that there's a massive cluster, and if you don't think it's a massive cluster with 3,000 people, then you might want to reconsider, because that is 3,000 people. That's a neighborhood in any of the other islands. That's a neighborhood. That's a town, a little town in any of the other islands. But no, for Lanai, it's the entire island. It's the entire population. So yes, contact tracing is vital, but where do you put these people? How are you going to isolate these people in Lanai? And And while that's happening in Lanai, Oahu is celebrating because we can go to tier 2. Don't you think that it's just a matter of time, like we've been saying for so long, because we're no different than any of the other towns and cities on the mainland, that when you open up that travel, when you allow more people to come in, twice as many that you expected, more than you can actually handle, not only in the testing but in the contact tracing, and we'll get into the testing component later. But what were you thinking? And how do you backpedal out of this? As the group of people that decided that it was going to be safe, we didn't have to worry that it was going to be up to us. Make sure that we, the residents, wear our masks and social distance. That it was all in our hands, on our shoulders, if we were to succeed or fail. Never once did we ever, and not we meaning the government, never once did the government put any blame on the visitors that were coming from hot zones, that were getting by with a test that may or may not be accurate. But Lanai, we don't know. I mean, and I honestly don't think they'll find out, Charlie. I don't think they'll be able to contact trace that back. I really don't. What they're going to say is, yeah, somebody traveled, the resident traveled, and everyone else never wear masks. So that's how this virus spread. That's what they're going to say. They're going to say it's because we didn't practice safe. We got to do a better job. And in the meantime, we got well, according to this post here, according to Senator Kalani English's Facebook Live, with 23 active or positive cases now. You know how many families are connected? How many human beings are connected to 23 families right now, or 23 people right now that are worried to death because what's going to happen next? Who else did they come in contact with? Lanai is a small place. So,
folks, having been there before, having worked there before, even as the union head of Maui County Police Department, having gone there to talk to the members. Even when I got off the plane, it's you get off at the airport, you go Malka on that one highway, make a left turn, you're gonna pass the first gas station, off to the left, go get one gym, and the city is like you on horseshoe on you. Tall trees, beautiful. That's it. The homes, everything is within, you can throw a rock at your neighbor's house. The neighborhood is so close together, plantation style. But let me tell you, gang, it's a close community. You have the old with the new. And I can tell you right now, it is. I said this before we came on. I told Mel, we're not going to beat up anybody. We're just going to try to bring out the scenario that's unfolding right now. And this is the scenario. So we're not trying to blame anybody. But what we're afraid of, and we talked about this before we went on air, how do you stop it? How do you stop it? Because at the earlier news today, it was 16. That's why we was jumping on 16. And now you go 7 above that. So, I mean, come on, did they test all 3,000 people? Are they doing a surveillance test to see, how many of them got infected? Because in my understanding, they only recently got their kit. I mean, Angela Keene was the one that broke the story to us, right? About the kit, that one testing kit. And so I don't know where they're getting
the actual machine.
The machine. So I don't know where they're getting their tests, or their even the, I know they got the kit there. I mean the machine, but I don't know where they're getting the supplies from to test all 3,000. So it's going to be very.
I know they're planning on doing some testing. I saw that they were going to be planning on doing testing for whoever needed or wanted testing. But again, I mean, it falls back on where was the origin? Was it a Hawaii? Was it a virus? Was it transferred from someone that came in contact with the Lanai person on Oahu, or was it from the mainland? And again, we really won't know. We know that Lanai has 16 cases, but it's interesting because when you look at the State Department Health report today, they're still saying 4. And yes, that numbers may have come in after they posted the report, but in essence, if you think about it, it's you count that additional 12, we're now up to 90 cases in the state. And um, hmm, it's a lot of cases. It's a lot of cases. And when you talk about the testing, Charlie, and how do you go from 9 positives on the Big Island? Remember, with the big 9 people came in, tested positive. They tested them again. 5 got cleared. 4 was confirmed positive, and then today they came out and said, "Oh, by the way, that 4, they weren't positive. They were actually negative." That doesn't leave me with much confidence in the testing, or it leaves me with absolutely no confidence in the reporting. You see, tier 2, and it all comes back to one thing, right? The visitor industry and justifying their move to open up. So we cannot have big numbers because that won't work. It's going to be very hard to sell this to the people if our numbers are growing. And tier 2, if you think about it, tier 1, you could go eat with your family. Now you can go with members outside your family. Who does that benefit? The tourists, the visitor. They had to go to tier 2 because, as you said, Charlie, when you look down the shops and stores on Waikiki and down in Honolulu, boarded up, closed, no can open. So the tourists come here and they are without anywhere to go. So we had to rush tier 2. And that is scary because Honolulu is 1 million people and majority of the visitors flying in from the mainland are on Oahu. So, I'm worried. I'm very concerned about what what's going to happen in the next upcoming 7 to 10 days. I really am, and I'm very concerned about Lanai. And as I often say, if you believe in God or you believe in a higher power, please pray for those our friends and family over there in Lanai, because it does not look good over there. Those numbers and at the rate it's climbing is not good. So please, tonight before
Well,
you go sleep.
I got 4 of them that we all work together as police officers, and I'm worried about them. But they old school. They old school. They stick to themselves. And I'm just wondering, I'm still baffled because I would like to know, if it is spreading on the island, in what direction is it spreading? If it's employees at a location that spread, then everyone needs to know from there, where do they go? I mean, there's not much to do on Lanai. So everybody goes to their little corner. But what is the routine? Do they stop at the general store before they go home? Or do they go straight home? Will they come in contact with? All of those kind of things, you got to figure them out really fast. Now, the question is, somebody report that the CDC says this, the CDC said that, again, gang, the CDC is not the almighty golden rule. That's a guide. And I've always said it from day one. Let's exceed it to be much safer. But, good point and an example of what I'm saying is, Avalon always said, yeah, we followed the CDC guidelines. Where did it get them? That's how you got all those deaths at that veterans home on the Big Island. I've always said, why didn't you exceed the guidelines like the nursing home that's across the street from the Hilo Medical Center, which is a stone throw away from the veterans home? They exceed the guidelines and they never had one infection. So it makes a difference. It makes a difference, gang. Okay. A lot of times people say, well, we follow the CDC guidelines. That's telling me one thing. You're getting yourself prepared to mount on defense if any lawsuit come your way when you say that. Okay. You should be thinking about how you're going to save lives. That's what you should be thinking about.
Well, for those of you that read the CDC, I don't know if you don't. It's so funny because they'll post the CDC guidelines that that support their position, and that's fine. But I don't know if you folks saw today's CDC's turn, where you remember, Charlie, the CDC said that a contact that was considered a close contact is that you have to stay with a person or get in close, intimate contact with someone for 15 minutes. Remember? That's what the CDC said. If remember that whole thing, if you never came in contact with someone that was within 6 feet for at least 15 minutes, that wasn't considered a close contact, and you didn't have to get tested. Well, today, fresh off the press, they changed it now, and they said, and let me just read this because I just pulled it up because I didn't want to misquote the CDC. But for all of you out there that put your faith and love and trust and everything in the CDC, it says the new definition includes exposures adding up to a total of 15 minutes spent 6 feet or closer. Previously, the CDC defined the close contact as 15 minutes of continuous exposure to an infected individual. The agency changed the definition after a report from Vermont of a corrections officer who became infected after several brief interactions with coronavirus positive inmates. So this was in Vermont. None of these interactions with the inmates were lasted 15 minutes or more, or more than 15 minutes. So what they're saying now is what used to be one constant 15-minute contact. No, they've changed that. And this just came out today.
No, this is
So
what
it means,
this is what I'm baffled at. What you just read, there was a plural there, inmates.
Mhm.
But just so happened, this poor God, who must be on gambler because he hit it big by going to each inmate that was infected. So it's because that theory of a cumulative time, right? 15 minutes. So that means you got 3 infected inmates, 5 minutes apiece. Bingo, he qualifies. Now see, you got 2 inmates, right? You got 2 inmates, positive, 1 negative. You spend 5 minutes each. Does that 5-minute break means you break the cycle and you don't get infected? That's this is like when you're gonna trace a call. They tell you you gotta keep the caller on the line for 10 minutes. You fall 1 minute short, you don't find out the location they're at. But you gotta keep them 10 minutes or more. So this one is if 15 minutes, if I go 14 minutes, I shouldn't be infected, right? Because I never hit the 15-minute mark. Make sense?
yeah. So basically, what they're saying is it's almost like arsenic poisoning, right? Arsenic poisoning. It accumulates in your body. So you get the little dose, little dose. It doesn't flush through your system like most other substances. But in this case, the guy he was opening, closing doors. He was changing linen. He was doing health screening, and it looks like the 6 inmates that this guy was assigned to never had symptoms, but they had gone to out of state facilities and come back, and they were awaiting coronavirus test results. And this guy was in charge of or working in that ward, or that ward where these quarantine inmates were, but he never stayed with one inmate for 15 minutes at one time, but collectively. So basically, they're saying, and that's why this virus changes every day, and what the information changes every day. So what we talked about, the CDC said a month ago, may not be applicable today. This makes it even more scary because, especially if the people working in hotels, right? So you may not be in close contact with one guest. You may be at the front desk and you're checking in 5 different people, and each check-in takes 10 minutes, 8 minutes, whatever. We try to hit them about 6 minutes when at the hotel I was working, or less. But let's say you're checking in a line of people. You're at the airport, TSA, and all of these people that are coming through that line may be awaiting test results, and they may be shedding virus, and you don't know. You don't need to be up in their face for 15 minutes. That's what the report is saying. So it just keeps us. You got to be vigilant now. You got to be very careful. You got to make sure you wear your mask, and make sure they wear their masks. And that's how we can stop this thing.
You see why I get upset now. And I promised I wasn't gonna get upset. But why I'm getting upset now is because now you're throwing a new blooper into the formula here. right? Because
Mhm.
number one, why is it so important to put minutes down when you just say you had contact? Well, does the science show that, oh, you got to get a cumulative 15 minutes? And now you can easily say, well, we're changing the variables on you just as long the total amount of time of exposure is 15 minutes. So you can have 15 people at 1 minute each, 3 people at 5 minutes each, or one person at 15 minutes. That's the way I look at it. And I mean, it's like, okay, you're kind of getting me confused there. What the hell am I going to do? And I wish they wouldn't do that. It's almost like the mask, right? The mask mandate or whatever they call it. That, you if you're in 6 feet range, you got to put on a mask. But if you're out of that range, you don't need to put on a mask. Like, why you use the word 6 feet for? You just throw off the whole damn thing now.
Exactly. I
That's
agree.
why I was never good at Monopoly because I don't know. I like buy hotels, but I don't know how much costs. I just don't know. I just say, give me the damn thing. I'll go play my own game. You know?
No, but you hit it right on the head. That's the same thing with the mask mandate, but only if you're 6 feet 1 inch away from your friend, you don't need to wear a mask. I mean, come on, man. If the mask protects you, wear the mask, and it should be it should be a mandate for always. I mean, if you're out and about near anybody, you wear a mask. You just wear a mask. Yeah, but that kind of explains Lana. Lana, our friend from OCCC. I don't know if she was ever in contact with one positive person for 15 minutes. So when imagine this though, Charlie, right? Prior to today's opinion or whatever recommendation,
Hmm.
when they're contact tracing, right? And they say, Charlie, in the last 72 hours or whatever, have you come in close contact with someone for more than 15 minutes, for 15 minutes or more?
Yep.
The answer might be no. But if you work in a jail or you work in a hotel, and now they're going to ask you, how many contacts did you have with people in the last 72 hours that you may have spent a cumulative time of 15 minutes? And then it changes the whole picture, right? Because all of a sudden, now, well, wait a minute. I went on a string of about 20 minutes of checking in people, or checking people in at the airport counter. Yeah, I didn't spend 50 minutes with one person, but I spent a lot of time with a bunch of people that lasted over 15 minutes. So, it's the bottom line is this, Charlie. This is a dangerous virus. Yeah, we got to treat it as such. We got to treat it as a dangerous virus. So, whether it's 15 minutes, 1 minute, somebody sneezes on you, or you walk into somebody's cough or sneeze, um, it doesn't have to be 15 minutes. That one sneeze will do you. So we just gotta be safe. Everybody gotta be safe.
And that's the point I'm making with the CDC. And I just wish they would, you know, if you're gonna do comparison, then do the study right way. If you're talking about inmates, then the CDC guideline says 15-minute cumulative exposure towards inmates in a closed confined space, because that's where most inmates. You're not talking about in the rec yard. I don't think. So whatever study they use, where was the guard in relation to the inmate? You should spell it out how the study was done, because I'm sure it's different for, say, someone who works on a bridge out in the open, right? And you got so many people under the bridge being suspended under there while you patching up the bridge because it's cracking or something, whatever. It might have a whole different. And I'm all for the fact that, hey, just tell them, if you're going to be exposed to somebody that's not in your safety bubble, wear a mask. Plain and simple.
Just wear a mask. I mean, if everybody wears a mask, I guarantee the numbers will drop. I think enough experts have said that, and that's just kind of how it's got to be. Because again, do you rely on the testing? Absolutely not. I don't. I don't. I mean, I think testing is important, definitely, but you can't put your life on it. You can't bet your life on the result of one test. That again, we'll try to get Dr. DeWolf Miller back on to explain how that happened. How the heck did we go from 9 to 0 all of a sudden? You just keep testing them until you get the negative. Oh, okay, this guy, we got a negative. He can go. Do you just keep going until what could be a false negative? Because you want to make sure the public is so comfortable with and confident with this test. But what they don't understand is the lack of transparency, and they're not explaining what's going on other than telling you, oh, by the way, the 4 that we had positive are now negative. That's not enough. Was it a testing error? Was it a defective sample? Was it a defective test kit? Was it a problem with the labeling? Was it a problem with the packaging? No, just no. Take our word. What we thought was 4 is 0. So you didn't worry. Our program works. I cannot believe that. I cannot be confident with that. I cannot be comfortable with that. So,
Well, I'm just gonna say, cheers to you, my brother. You're bringing out some good facts. Everybody out there, if you have a little Snickers in your hand, cheers to all of you as we take a nice bite of this right now. Mm, 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 mm.
I got my Starbucks coffee. We had to go deliver some shrimp out to Kilauea. So on the way back, we stopped at Starbucks to get some coffee. The other thing too, I think we cannot forget is that as of today, we get 3,045 active cases in Hawaii. 3,045. And I don't know how many of you watched the news this morning when the reporter was asking Lieutenant Governor Green, hey, aren't you concerned about the active cases? Because while the numbers may seem to be going down, the active cases continue to rise. And Josh said, well, don't pay attention, don't pay attention to the total of active cases. We should just be focusing on the active cases in the last 30 days. Why? Why? I mean, why? I want to know how many active cases we get in a state. I don't like in the last 30. What the hell does that have to do with the price of tea in China? Absolutely nothing. We need to know how many active cases, because that means there's 3,045 people that we know of that should be anyway in quarantine someplace in this state. And so, yeah, I mean, the numbers do matter. The numbers of hospital beds matter. The number of admissions to the hospitals matter. Trust me, the hospitals are occupied with COVID patients. They don't talk about that. They minimize it because they want everybody to feel comfortable. And I understand. I mean, nobody wants the state to go into chaos and freaking out. But you see, when you minimize it and then a lanai situation pops up, then why not just be honest with the people? Just let them know what's really happening, and then you give the people the choice to do what they want to do. If you want to go take a risk to yourself, you go do it. But do not do anything that's going to put others at risk. But when you try to convince the public here in Hawaii that it's extremely safe, everything is working well at the airport, the tourists are, we found out today, 40% of the arrivals. 40% of the arrivals from the mainland, everyone, 40% of the people that came back from the mainland, whether it's returning visitors or tourists, opted out of taking a test and chose quarantine. 40%, Charlie. Explain that one to me. Hey, honey, we're going to go to Hawaii. And listen, honey, should we go take a test so we could go to Hawaii and not do quarantine, or not take the test, which is not even a shot or a needle or anything, and then we'll go stay in our room for 14 days. What do you want to do? Honey, let's take the quarantine. Damn, the kids and us, we're gonna have fun in the room. We won't be able to leave the room. Yeah, let's do that. 40%. You know what, Charlie? This is what happens in many cases. It's pure speculation.
Okay.
Hey, honey, I got my result from my test. Let me open it up, honey. Holy shit. Honey, I'm positive. Shit. And we'll leave tomorrow. Honey, we ain't using this. We ain't using that, man. we're going on that trip, and I feel good. I'm not sick. What's your test show, honey? Give me your test. Holy shit, you're positive too. We can't let them see this. We'll opt out of the test and let's just go to Hawaii and enjoy. Yeah, we'll tell them we'll quarantine, but I heard it's real easy to get away from quarantine. Yeah. Especially
No,
in Honolulu. They don't even check.
no, they're gonna tell the husband will tell her, honey, let's call Billy Bob. He went last week and he was in quarantine, but damn, he sent those nice pictures from Diamond Head and Waikiki. Let's ask him how'd he do it.
I tell you. Angela King, you're gonna be busy, sister. You're gonna be busy. You're gonna be real busy, sister. See, they come to Kauai. Today my friend's daughter came home from school on the mainland from Washington, so she's at home in quarantine because she wasn't able to get the test. So she's at home with her mom and dad, and she came in on I think she came in day before yesterday. They were at her house today. They were at her house yesterday. See, come to Kauai, you best be staying in your room, or y'all gonna get arrested. You're gonna get arrested. So
Yeah, they got Billy Bob and Maggie Sue.
honey, they don't care, man. Just check out the Facebook post. These guys are man, there's no problem to ditch quarantine. But man, if they find out about this test, we ain't gonna be able to get on that plane. So you hush up, all right, honey? You hush up. You don't mention a word. We don't mention a word. We never took the test. You understand? You understand, honey? We spent way too much money on this trip. We're going. We're going.
Oh my goodness.
That's, ladies and gentlemen, that's what happens here. I'm telling you, man. I mean, just
That's scary.
not all, but put yourself in that person's shoes who just, put in 5, 6, 7 grand, and your test come back positive. Oops. Oops.
Hey, let's call Billy Bob. Oh, Billy Bob, we're in this predicament. We're in this predicament. We got to go to Hawaii. You got to tell us how to get out of the quarantine. He says, well, you buy yourself this burner phone, and you forward all your calls to your burner phone, and you leave your burner phone in your room because they're gonna call your phone. But just make sure you don't have no background music when them hula girls and them hula guys are dancing next to you. Just cover them phone up, so you can't hear it. I'm sorry, we terrible. This is terrible. We shouldn't be doing this. Oh my goodness.
Hey, honey, you know what we do? I tell you what we do, honey. You know when that app they gave, that thing we got put in our phone. You know what we do? We just put someone else's address. That works too. That works. Yeah, you go on the map. You just go on the map, go Kauai.com, and you go ahead and you look up an address. Just put anybody's address because they don't check. And we go on about our business. We ain't gonna get caught, honey.
And you get on that app, you got to get that code. Well, you go to the store and you put the code on. And I put a code on, but this code belongs to a furikake. A furikake, that's the stuff you put on your rice. But it looks like one of them codes that will get us out of jail free. It's right here on my phone.
and then we fast forward 5 days. 5 days, okay? Hey, Patsy. Hey, honey. Can I get some more coffee, please? That's not acting. That's not acting. I really need some coffee. But anyway, 5 days, right? We came on a plane. We're enjoying Hawaii. We're having a blast. And it's on the 5th day. I wake up, Charlie. I wake up, man. Hey, honey. Damn, my throat hurts. My throat hurts, honey. You think that damn COVID got me? You think that COVID got me, man? Damn, my throat hurts.
No more coffee for you.
That's not coffee.
Cutting you off.
Oh, you kidding?
Cutting you off.
Honey, my throat hurts, you know? Doggone it, I can't taste a thing. I can't taste a thing. I think I read that map might be COVID. I think we need to go to the doctor. And the wife says, "Are you stupid? If you go to the doctor, they're gonna keep our ass here in Hawaii in quarantine until you get your test back. We gotta fly out on Sunday. You go, hell no, you suck it up, Buttercup. No, 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 no."
Yeah, and then Billy Bob goes to the airport to catch the plane. He's like this. Are you okay? Yeah, I'm just fine. Nothing's wrong.
So the guy's gonna fake it, and he's not gonna risk getting caught in Hawaii with COVID. So he's gonna go and continue his vacation, take some Tylenol or some Advil or some Aleve, and he's gonna be spreading the germ, man. And then he jump on that plane and go back home.
Yeah.
You know, we make fun of this. We make fun of this only because we're making a damn point. We're making a point that this system has a lot of flaws. This system has a lot of flaws, and that's why we that was totally impromptu. That we never planned that, stage it. But you know what? I know it's happening. I know it's happening, and there's how do you stop it, right? How do you stop it? So, we got to be careful. We got to be careful, and the state's gonna have to step it up. I mean, they're gonna have to step it up. We're gonna have to get these. You know, somebody told me today. We was just talking, and something that all of us suggested way back. Even the Senate COVID committee, even the Senate president, even the lieutenant governor, that we should have a quarantine hotel, and that everybody comes off that damn plane got to stay in a quarantine hotel. And you know, the time of quarantine, there's all kinds of arguments for all the different number of days, but the bottom line is you quarantine them until we can get them a second test or get them a test. And you know, that's what our mayor wanted. He got rejected, yeah, because we didn't want to inconvenience the visitor. Big Island thought they could beat the system by giving them a test when they arrive. Okay, good try, Harry. It didn't work. And so without that quarantine facility, which is what all the successful countries are doing, because we have rights here in America, which I think is hogwash. But I think when you're in a pandemic, certain things, you have authority to do certain things. And I don't think it's unreasonable. It'd be unreasonable if you stuck them in a jail, in a cell. But if you put them in a nice hotel where they have all the accommodations and they have food brought to them, that's a choice if they want to come here. You want to come here, that's the conditions. If not, don't come. Wait till it's over. But, you know, our state took the easy way out and just pretended that it wasn't an issue. It wasn't a problem. Oh, like I said, go tell that to the people in Lanai right now. Go fly into Lanai tomorrow, Governor. Go walk and go tell the people, hey, hi, everything is working well. Everything is working well right now. Thank you all for your cooperation. Certainly, we have a few cases, but that's going to happen. We expected that. Nah, man, I don't think they're going to welcome you too well, bro. I don't think they're
But
going to welcome you.
I just saw something come across the screen about it's a while back. I trying to find it, but it had to do with someone's family landing at an airport or something like that.
I'm trying to find. I'm sorry. I'm just scrolling up. Got to make sure I catch as much of these comments as possible.
Yeah.
They acquired some hotel rooms at the Park Shores. Yeah, the Honolulu did. They used CARES money. Honolulu secured 462 rooms in 3 hotels, but that is for isolation. That's for isolation. That's after you test positive, and that's kind of too late. That's kind of too late. You know, we're talking about a quarantine hotel where you come off that plane, you get on a city, county, whatever transportation shuttle that takes you to the quarantine hotel or the facility, and that's where you stay until you test negative. That's what I'm talking. Not after you get the positive test, and then it's like, oh, where do I go? Oh, here we have a hotel room for you. No,
Mm.
no, we're talking about a quarantine facility where you remain safe for you and for the residents who really we should be protecting until you can prove that you are negative and you don't have the virus. That's what a quarantine facility is all about. And I don't understand why we don't do it. Every other country that's successful does it. And yeah, I understand. I understand we own constitution and blah blah blah. But we also have a constitution that allows us free travel. But try go to the airport without one shirt, or try go to the airport or get to the gate all drunk. You have a right to drink. You have a right to drink, but you don't have a right to get in a plane drunk. Try bring one bottle of water. Bottle of water. Go to the TSA that you buy them outside, sealed, locked, tight, everything. Go, sir, you cannot bring that water. Well, no, I have a right. That's my water. I paid for it. Sorry, sir. That water cannot come on. You can drink it, throw it away, but you're not coming through. Well, he get rights. No, but in this case, that rights don't you don't have that right because it's TSA. Same thing with COVID. What the hell? When was the last terrorist attack we had, Charlie? Seriously. I mean, we've had the bombings of marathons, we've had these incidents all over the world, but or the country. But really, what is a bigger threat right now to the people of Hawaii? Their terrorist attack or COVID?
Cold,
How many
cold.
people died today of a terrorist attack on Kauai? Was it in Hawaii? Was it more than four? No, no. See, so if you want to come here, you come here and we're gonna be safe for everybody. And that's where I get pissed off when people say, "No, you cannot tell me I gotta wear a mask. No, you cannot tell me I gotta take a test." Well, I beg to differ because we gave up so many rights after 9/11, and we do it. We want to travel. You know what? We cannot drive to the next state, but in a mainland, if I don't like go through a TSA line, I can drive my own car, and I can take my bottle of water. I can take my perfume bottle that's over 3.4 ounces or whatever the hell the limit is. But you can't do that in Hawaii. You cannot. So if you want to come here, this is the rules. If you don't want, then just wait till we're safe. That's all. It's incredible.
Right now there's, both you and I, we talk about this a lot. We get so many sources. And right now we're getting so much information coming in the hospitals. And we wanna thank everyone who gave the information. Some of the information we're not using because we want to respect, I should say, the privacy of those patients because it's not our place. But one thing I would like to say is that I just wish everybody be up and up and tell us the true numbers of cases infected, not this kind of hogwash that we get sometimes. And that's why it sort of lends itself to the naysayer, right? To the anti-maskers, because right now we're trying to fight a fight with everyone buying into it because we want everyone to be safe. But the administration is not making it easy, or I should say, the mayor, like say, give example Honolulu, does not make it easy when they put out this emergency rule that has so much loopholes in it, right? It has so much loopholes that it begs someone to please violate it. I even look at it, I want to violate it. I'm sorry. But I come from the old school. When I first got on the force, the laws were black and white. That's why they say you watch when you retire. You so black and white, you don't know how to live the gray. Because in life, there's areas that are gray. And I said, well, I'm sorry, because like I taught my kids, what is right, and what is wrong. When you start dabbling in the gray area, that's where a lot of trouble can happen. And I don't want that to happen to anybody. And so, when they put this kind mandates together that, I said it from the beginning, we gotta find a way to get the proper messaging so everybody is on board and everybody can buy into it, whether you're in Kealakekua on a big island, or if you're in Holehu on Molokai, or if you're in Haleiwa on Oahu, or Kaumakani on Kauai. The rules are the same. It goes across the board. We shouldn't have a problem. But how we can tell that not everybody's on board? Because Mel and I, we feel these questions every day. Everybody asking, oh, you know, what's the rule over here? Because I don't know. I know on Kauai's rule, but I went, oh, Oahu, what's their rule? You know, and I feel sorry. And I said, you know, why does it have to be that way? You know, if we're talking about compliance, how do you comply with a rule that doesn't even make sense to begin with? I mean, you should have left it up to somebody like us. We'll make the rules tough where, number one, it meets the constitutionality. Two, you don't follow the rule, you're going to get cited, plain and simple. You don't have to be on brain surgeon to figure that one out. But I don't know if they put in some of these rules just to give enough leeway just so people can feel comfortable. But studies have shown, and we see it time and time again, the first number rule that's been violated right from the get-go is masking. We don't have to say much. That's been the topic for these last couple of days since they opened up. The only thing that's made available to every man, woman, and child to prevent themselves from catching this virus is what? Wearing a mask. Social distancing. These are two key topics they always talk about in your safety arsenal. Okay, social distancing and wearing a mask. And yet local people driving, minding their own business, going down Kalakaua or wherever, right? Look to the right. Oh, mommy, look, the guy no more mask. You can tell they're on Traveler. They're walking down the street with one of those roller bags, you know, the suitcase that with the wheels, rolling down there. That's not local. They're rolling, look like they're gonna look for their hotel, and they no more mask on. Now, granted, you know, maybe you could say he was exercising, but nevertheless, how does it look to everybody else when we all got to wear masks? Remember what I said before. The use getting into a confrontation, just make sure your safety comes first. If that fool wants to get sick, then you know that skit we just did a little while ago with Maggie Sue and Billy Bob and all that. That's what's going to happen. You start getting that sore throat. And you cannot blame us for making fun of those kind of people because you know what? Many of them got sick, not of their own choosing. But to me, the ones that just want to disobey and they just want to walk out there as if that's my right. Remember I said the other night, yeah, that's your right. And you know the airplane you rode over here, you had no problem wearing a mask for 5 hours because you wanted to get on the plane. How come you never exercised your right back then? Because you knew you wouldn't be able to board the damn plane. That's why you never act up. But yet, once you touch land, you start acting operating. And that's not right. That's not right. So hopefully everybody take care and be safe. That's the bottom line. And you know, another person asked about, remember a couple of nights ago, we talked about a plane landing in Princeville. Yeah, somebody just asked about that. You got any info on that, brother?
Just what I've been reading on Facebook, and I did speak to someone today that definitely got the confirmation that an aircraft landed in Princeville, and they came off the plane and they were exempted from quarantine by the Lieutenant Governor. That's the information I got from this source, who is very, 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 very credible. I am looking into it a little further, but you know, right now everybody's hush hush, everybody's scared to talk. So I'll leave it there because until I get the information. But as far as I'm concerned, there is not in dispute that that aircraft did land, and that in fact people came off, and they were granted an exemption. So that story is still developing, and as soon as I get the info on the specifics, you can trust that I'll put it. We'll talk about it. We will talk about it. That the kinds of things that drive people nuts. And you know, not that I'm defending these people that are coming here that took the test from the wrong provider, but we have a lot of people that's coming from the mainland that took their tests from companies that are not on the trusted partner list. And remember, the first 48 hours, the governor basically waived it, said, hey, it doesn't matter. Whatever paper you get that says you're negative, you're welcome to come in. And that first 2 days, there were a lot of people that came in, and there were a lot of people that came in with tests that weren't from the trusted partners. But on the third day, there were no exemptions, so we had a lot of people that flew in that when they got to the airport and they found out that when they arrived that their test was not valid, that they had to go to quarantine, they were very upset. And Charlie, if people got to know that, and if any of you guys watching the show have family or friends that are coming to Hawaii for whatever reason, I know I got some friends that are coming. My friend's dad passed away in Alaska, so they're bringing the body back here. So a big the family's coming here to lay him to rest. But if any of you have family or friends that are coming back to Hawaii, let them know that they need to use the trusted partners, or they're not going to be excused from quarantine, regardless of the negative test. So make sure you let those people know, um,
Yep.
because they're not allowing. So again, and the reason I brought that up was not because then you get this private jets that come in and they have gotten some special treatment. It's just not fair. But we'll definitely will dig as much as we can into that. But
Oh, yeah.
you if you travel somewhere, Charlie, if you go, you traveled. I traveled a lot. You call ahead and you make sure you get everything you need when you go to this new destination. So there's really no excuse. Don't come here and say I never know. I never know. Really, well, enjoy your 14 days in your hotel room, people, because you never know. So unreal.
I think the bottom line, gang, we have we have really sifted through a lot, and the only thing that's changing right now that I can see is the virus and how it's acting. And that's just from what we see from people who have recovered, and they're not fully recovered because they have all these issues that follows them, to those who recently said they got sick, went into isolation, came out of it, and just some of their physical reactions to the virus wasn't like anything we heard before. So we know that it's doing something. And I forget which doctor we asked. I said, I think I even asked this of Dr. Kim one time, is it possible for this thing to mutate into something that's different? Well, what we know is about the aerosolizing. Remember, there was a question. And we know now that really 6 feet is not enough. It is not enough, because 6 feet was based on droplets and not micro droplets. So I had to go look up what's the difference, and micro droplets is even smaller. So it's the ability to get on that bubble and just float wherever it wants to go. So as you can see, again, I don't know how much more we can say about uh, being cautious, always being cautious about this virus. Okay. You got to get into a routine, how you take your mask off, how you sanitize, how you put on a new mask, how you sanitize. Everything you touch, sanitize. But I still see people, and you know what I've noticed ever since we opened up, Mel? I just noticed it today. I just noticed it today. And here on Kauai, and it's sad, because we're opening up, I saw complacency, which I thought I never would see from some of the residents, local residents. Very, very complacent. You know, uh, I see them touching all kind of stuff and not even, using any caution. And those are the kind of things that will get you sick. It may not get you that time, but if you get into this repetitive behavior, you're gonna do that in maybe in an unknown area that's outside of your safety bubble, and you're gonna get sick. You're gonna touch your eyes, and you're gonna wonder why you're starting to get fever. You're gonna wonder why you cannot lick the fever. So it. If anything you can do is do something repetitive for your safety. Okay, you're gonna sanitize all the time. So you get into a groove that every time I touch this, I gotta sanitize. Anytime I do this, I gotta sanitize. It might sound anal, but hey, I'm doing it. I'm doing it. because like I said before, I'm an open heart patient, right? So I get high risk, and I just don't like take a chance because I gotta think, what if there's no beds available on Oahu? What if there's no flights available to medevac me out of here? I was lucky when they did that at PMRF. I may not be so lucky the next time, but I don't even want to cross that road. And I'm just telling you folks out there, you're gonna have to cross that road one day. And let's hope that you never get that serious that you gotta go that route. But all I'm saying is everything you touch, you gotta get into a routine. You gotta wash your hands. And I bet you right now, most of you get in your cars and you don't even wipe down your steering wheel or wipe down the AC outlets because you take it for granted. Nah, not gonna get in here. That's not what I'm saying. You might have brought it into your car. And the virus does survive for several hours and even days on certain surfaces. And if you don't know that, I would tell you, go Google it, get yourself very familiar with the life expectancy of a virus outside of the host carrier. Okay? That's what I'll tell you.
Well, as horrific as this virus is, yeah, as bad as it is, prevention is very simple. Those things that Charlie just talked about, yeah, it might be a little inconvenient, but it doesn't take much to protect yourself. Yeah, and if we all practice that, then we can really cut that stuff and isolate this virus. But when we see the complacency, and again, we like to blame the tourists, but it's not just the tourists. Trust me. I we got a lot of local residents running around, as Charlie said. So we got to take it upon ourselves. I mean, I just feel like repeating myself over and over, but I don't know how else to get it across. I mean, we're preaching to the choir, I think, for the most part.
Mm-hmm.
But hopefully, we get to somebody that maybe we connect tonight, and somebody finally going to say, "Bing, that's right. Damn, I didn't know that." And that's why we do what we do. So we apologize to those of you that got to listen to this crap every single night. But to those of you that just brand new or never hung out for the whole show and you're hearing this for the first time, that's why we do what we do. Just got to keep yourself clean and sanitize and wear your mask. Because listen,
why we do it is because we love them. That's really why we're doing it. Because number one, we're not getting paid to do this, and a lot of you know my personal journey with this, and I don't wish that upon anybody. And because we love you folks so much, a lot of you have stood by us from day one. And then, sometimes we got to, even me, I got to be reminded. So it doesn't hurt to get a friendly voice, a calming voice on the outside saying, "Hey, brother Charlie, don't forget now, you got to do this. You got to be loyal to what you do."
and it is, we when we're talking out here, and when I'm sharing what I'm sharing, I'm also talking to myself to remind myself that we cannot be complacent, that we got to be careful. And we got to make sure that we do what we need to do, because the last thing we want is 13 cases on Kauai, 16 cases, 20 cases. Now the most recent post, looks like they confirmed that there's 20 on Lanai, not 23 as I said earlier. But 20 cases on Lanai. We don't need that over here. You know what? There's no real difference. We still get people traveling inner island to the mainland and back. So because of the way that our system is set up, it's very easy to let this virus in. So we gotta be better. We gotta be better than that virus, which means we gotta be. It's just gotta be second nature for us, automatic. Automatic. We have the paper masks. We just had to go deliver shrimp, and I forgot my mask. I didn't expect to get out of the car, but in the pockets of both of our cars, we have, those, you buy them in a box. Very cheap. It's very cheap. It's not N95s. It's just like the what do you call it? The surgeon masks or whatever. And you buy a box of 50 of them. They're individually wrapped. You get them from Amazon. It's not expensive at all. And you just grab a handful, stick them in a pocket. And that's exactly what I did today. As soon as I said, damn, because we got out when I actually had to get out of the car. I said, "Oh, damn, Patsy," because she was driving. Grab me one of the masks from your door pocket. Open them up, rip up the plastic, fruit, and it's in. And I got a mask. And it's got to be second nature. It's got to be second nature.
Yep.
So anyway, Charles, we're at the witching hour. Halloween coming up, man. We did a special Halloween show.
Yep. You know, I don't know about you folks, but most of the houses that I go trick or treating to, I know them by heart because why? They all have Snickers, only Snickers. That's the ones I go for.
Well, I know there's always I mean, there's a lot of community groups that are getting together for Halloween, and they're going to do trunk or treat where kids can actually go in the vehicles parked in a parking lot and go grab. So there, again, it's people say, oh, it's so sad we got to take Halloween away from the kids. Listen, just just for now, yeah, let's get past this. Let's get through it, and let's make this place safe again. So anyway, Charlie, any closing comments before we shove off?
No, let's pray for the people on Lanai, and let's hope that it doesn't. The old adage is it's got to get worse first before it can get better. I hope that this is the tip of the iceberg, and if it's not, please let's just continue to pray for them. They're isolated. We always talk about not having enough bed space here on Kauai. Think about Lanai, hardly any, and they're limited in the flights out of their airport. So they just can't go down to the airport, jump on a flight, and get the hell out of there. No, it doesn't work that way. So just keep them in your prayer. And to all of you that continually watch us, we thank you so much because I've noticed that through our show, a lot of you have carried the message on because people tell us, "Oh yeah, my friend said they watch you guys." That even though it's a compliment, but what it means is whoever you were that told your friend that made the compliment to us, that means that he got touched by what you said. So you're like a messenger as well. And you're in this fight with us. So I just like to say thank you very, very much from the bottom of my heart. It wouldn't have been possible without you. Thank you. Mel?
Thank you, Charles. Thank you. And exactly right, man. Thank you, guys. You guys do this every single night. For us, it's kind of fun because we get to talk and relax and have fun and share stories. And you guys got to just watch and type. So, but you guys still hang out. So we appreciate that. And like Charlie said, there's a lot of people on here that are on here because someone told them they should watch. And this thing goes far. I can tell you, a lot of people are on and watch this. So we appreciate all of you guys. Tomorrow night we're gonna break it up a little bit. Augie T will be on. Bringing Augie in. I was hoping he could come in today, do some hump day humor, but he'll be on tomorrow at 7 o'clock.
Hey, we did a damn good job, brother. We did a damn good job with Hump Day Humor today.
Did we?
We did some Billy Bob today. Billy Bob and Maggie Sue.
Patsy said, I cannot drink coffee anymore before the show." And it was an Americano. I had an Americano with 4 shots of espresso.
That's why.
Oh, golly.
It was awesome, man. But now I get a water. She gave me water so I can dilute my guts.
Yep.
But anyway, like Charlie said, we got to pray for Lanai. We got to pray for our state, pray for our country, because really, there's many states that's going out of control. So, but let's just say a special prayer for Lanai and Maui County and the rest of us, because this will be, this is just the beginning. As we said, I figured, 7 to 10 days we'd see some. I estimated the peak. Trust me, I am no medical expert, but just based on all the information we've gathered over the last 7 months, I figured 2 cycles of the virus, 28 days is when we're going to really see the impacts. And it looks like I may have been wrong, and it's going to be sooner. So, guys, fasten your seatbelt, stay safe. We love you guys. Charlie said it best. We love you guys. We do this because we love you guys. We don't want to see nobody get sick. We don't want to see nobody die. And if we all on this same journey together, we're gonna save lives. That's what we're gonna do. We cannot help it. We're gonna save lives. So with that, don't forget tomorrow night, Augie T. We'll have some fun. And he's gonna bring his daughter. Mahia, she's an amazing young woman. So she'll be on with Augie as well. Sharing some motivation, inspiration, and just some good fun talk stories. So 7 o'clock tomorrow night. We love you guys. God bless. Stay safe. Aloha.